Welcome to Kolkata, and I'm Dr. Mohandas, a medical gastroenterologist and a gastrointestinal oncologist, currently working at the Tata Medical Center in Kolkata. And today we are going to have conversation with Professor Raja Ali from Kuala Lumpur. Professor is the president-elect of the Malaysian Society for Gastroenterology, and he is also going to be the chairman president of the next EPTW, which will be held in KL. We are going to discuss the local problem of colorectal cancer, which has been emerging as one of the leading cancers in Asia. Professor Raja, would you like to say something about your experience you had in Ireland before you returned back to KL, and also why you returned back to KL?
Firstly, thank you, Dr. Mohandas. It's a pleasure to be in Kolkata for the first time in a lovely Asia-Pacific Digestive Week meeting. I think we must know in this time, for the last 2 decades or so, the colon cancer has been increasing steadily in this part of the world, in Asia-Pacific region. And also to note that the incidence and prevalence of colon cancer among the Northern or Western European, including in the US, has been stabilizing for the last many years. So we are witnessing increasing trend of colon cancer in the Asia-Pacific region. And I think there are many factors for that. We call them modifiable or non-modifiable factors. Among them is the environmental issues. We eating like a Western diet nowadays. A lot of people smoking. The obesity is rising. We all know that obesity is actually associated highly with digestive cancers, including colon cancers. And also, we're also witnessing possibly the paradigm shift of the gut microbiota in this part of the world compared to, let's say, 50 years ago. And also, physical inactivity is becoming more pronounced among the Asian. And many other factors like increasing age, everywhere in the world are aging society, and we all know that increasing age alone is a risk factor for the development of colon cancer. So I think with my experience in the West before, that we see colon cancer mostly in the 60 or 70 years old. We all know the data that colon cancer in Asia in particular, 90% of them are 50 years or above. But to also make a point here, the colon cancer that arising from the young in the age of, let's say, 40 to 50 in this part of the world in Asia Pacific also increasing. So there must be a reason for that.
What do you think is the reason?
I think there are many factors.
And do you think, if I may just add,
sure.
Do you think if people went back to the traditional diets, they will be able to prevent colon cancer?
The answer is maybe yes or no. If one of the reasons why colon cancer increasing in the 40s or the young age, I think many factors. But first we have to know 70 to 80% of cancer or colon cancer are sporadic form of colon cancer. So they because of environmental changes, because of not related to gene, or this is we call the epigenetic regulation. So I think in the young, probably diet. We eat more processed food, we eat more red meat, our diet becoming westernized for the last 2 or 3 decades or so. And of course, with the combined with these many diseases, I would consider as a precancerous, like type 2 diabetes is very common in this part of the world, hypertension, dyslipidemia, or in other words, metabolic syndrome. And these certainly add on the factors for young people who may potentially develop colon cancer.
So you have a unique opportunity in working in KL that you are dealing with 3 different ethnic groups.
Yes.
You have the Chinese, the Malay, and people of Indian origin, South Indian origin,
yes,
mainly Tamil speaking.
Yes.
So, and they have very big differences in their diet.
Yeah.
So do you observe differences in colon polyps and colon cancers among these 3 groups?
Yeah. So firstly, Malaysia is located in the Southeast Asia region. We have 31 million population, more or less, and we have three racial groups, which is Indian, Malays, and Chinese. From the colorectal cancer point of view, based on the National Cancer Registry in our country, we have observed they are predominantly happen among the Chinese and the Malays, and the Indian are far behind than these two ethnicity group. I think there are many reasons for that, not only genetic issues, but also the dietary issues. Possibly the Indian who living in Malaysia, or even the Indian living in India, the diet may be high in fiber, for example, and with also some anti-inflammatory, anti-apoptosis, as we discussed, like curcumin, gingers. So they certainly maybe play a factor.
Because sambar and rasam are two staple foods of South Indians.
That's right.
And that contains a lot of curcumin in it.
That's right. Yeah, I think the high fiber diet, ingestion of the high fiber diet is certainly one of the factors that contributing to the colon cancer. And we know nowadays that a younger generation in the 30s and the 40s, their high fiber diet is very poor. If I want to equate from the Malaysian diet point of view, if you like to take the normal or recommended daily allowance of diet high fiber, it's about 20 grams per day, meaning that if I want to equivalent with the 14 apples per day, no one is going to eat 14 apples per day. And we have studies done by colleagues, nutritionists. The intake of the high fiber diet is extremely low among Malaysian, Chinese and Malay as compared to Indian. But I think this is one of the reasons why the Chinese and Malay, in terms of number of incidents of prevalence, much higher in Malaysia compared to the Indian ethnicities.
What about colonic polyps and doing screening colonoscopies and doing polypectomies? Because there have been some recent controversies how often one should do, in which communities it should be done, what is the minimum baseline prevalence needed to run a successful program. So what are your views on those?
I think when we're dealing with preventive cancers, and certainly one of the cancers is colon cancer, I think we must learn from the existing cancer services such as breast cancer or cervical cancer. But I think the mass population screening is always cost a lot of money. But I think in Asia Pacific, that developed by Professor Joseph Sung, which is Asia Pacific scoring system, where we can stratify the patient based on the low, average and high risk by using a very simple calculation, look at the gender, the age, the smoking status and the family history. So if someone got a male, age 55, a smoker, family history, they actually qualify for the high risk. And this patient that we actually do colonoscopy.
If there is somebody in the rural, say in the forest or in the rural areas, will they have the same risk?
Well, I think people, let's be in reality, the diet people in the rural area is very different people in urban area. I think they are eating very fresh food, fresh meat, and they're very high fiber. So potentially they actually a group of patients who get lower risk compared to those residing in urban area. But I think we have to be very pharmacoeconomically cost effective in this aspect of colon cancer, because we should choose the non-invasive method first, which is, for example, immunofecal blood tests. Then we use this annually, and we will screen colonoscopy based on those who get positive tests. And I think this will save a lot of money, less fear for the patient, and we actually targeting the high risk of patients who get positive fecal blood tests.
So thank you, Dr. Raja, for the very informative discussions that we have had on the rising problem of colon cancer in Asia, particularly in Kuala Lumpur and Malaysia. And for all the young gastroenterologists, it's important that you take active interest in preventing colon cancer, particularly advising the young patients and their family members to maintain body weight, be physically active, avoid tobacco completely, all forms of tobacco, and try to go back a little bit to their grandmother's recipes and diets, which is high in fibers and spices, local spices, which are supposed to be known to be protective, and they also need to take sufficient interest in developing their colonoscopic skills, in reaching the cecum, identifying adenomas, and safely removing the adenomas, because these are the only ways that we can prevent the rise of colon cancer mortality in Asia. Thank you very much.
Welcome.